Hi everyone, it's Angel Face Amy here, and I'm back to give you answers 3 questions that every new ostomy patient has. We are up in the Upper Peninsula of Michigan so that we could see where my son's going to live this year, as he's a student at Michigan Tech University. And so we decided we would have a little family vacation at the end of the summer here too. So I thought I would just share this beautiful view that I've had for the last few days. So the first question that I'm going to answer is, how do I properly care for my stoma and skin to prevent complications? So for this question, the most important thing is that you know that if you think your appliance is leaking, if you think the pouch is leaking, if you have itching or burning or any of those things, you're going to want to just change the appliance. I think a lot of new patients are scared to change the appliance, and so they hold off. They wait till a home health nurse comes, or they wait until they're going to go see their doctor or a nurse. But in this situation, you really are and need to be your own best expert. And when you think it's leaking, you need to go ahead and change it, and don't wait, because the longer you wait, that stool sits on your skin and it will burn your skin. And then it's like a vicious circle and it's hard to solve the problem. So the most important thing is, if you think there is stool sitting on your skin under your appliance, you should change it. Obviously, I've made other videos with lots of tips and tricks about like how to do the skin crusting technique and what is the proper appliance. All those things make a big difference. But when you're brand new, most important thing I think is to not be scared to change the appliance. Okay, the second question that I'm going to answer is, what lifestyle changes should I expect, and can I still do activities like swimming and exercising? And my answer to this question is, your ostomy should not stop you from doing the things you love to do. In the beginning, you're going to need to wait until your surgeon says it's safe to do exercises and things like that. You're going to have to wait a certain amount of weeks. But in general, living with an ostomy should not stop you from doing anything that you like to do. There was a ostomy patient, a person who lived with an ostomy and played professional football. So if that doesn't tell you that you can do whatever you want to do, there's precautions you can take. There's things that you can do to make it easier and more comfortable. There are things like stealth belts and ostomy belts that hold everything on and prevent hernias, and these things will make it easier. But just because you have an ostomy does not mean that you can't do these things. So your ostomy should not stop you from doing anything that you like to do. And then the last question that I have here is, what supplies do I need, and how do I choose the right ostomy pouching system for me? This is a big question that I get, because a lot of times patients, they see all these different options and they just don't know what to try or what to do. So for all of my ostomy patients, I always enroll them in the Coloplast Care and the Hollister Secure Start program. So that means they will get samples sent to their home of Hollister and Coloplast. In the beginning, I think it's important that you just master one. So we at our hospital, we use Hollister products. So I send those patients home with extra Hollister supplies. And then when they get home, they usually have a home health nurse who will continue getting supplies and maybe hopefully continuing education with them as well. But once you master one simple product, like a one-piece Hollister product, then I feel like it's important for you to try, especially if you're going to live with this for the rest of your life, to try all the different options, or at least a few. So if you don't get enrolled in those programs, you can go onto their websites, to Coloplast Care or to Hollister Secure Start, and you can get yourself enrolled in those programs. And that way you can just try those samples and see what you like best, because every company has a slightly different adhesive and the product works just a little bit differently, and there's really no right or wrong. You just need to figure out what will work best for you, and the best way to do that is to try all the different products and see what you like best. So that is the 3 questions that I get most frequently, that I think a lot of new ostomy patients want to know. I hope this helped you. If it did, press the like and subscribe and share with other people. And from the Upper Peninsula, Michigan, I wish you the best. Take care.